Good evening, everyone. Welcome to the 1st November meeting of the Children Education Communities Policy and Scrutiny Committee. I'm Councillor Simon Daubeny, and I shall be chairing the meeting this evening. In terms of housekeeping, I'm not expecting any fire drill, so if it sounds, I think everyone present knows the route out, down the stairs and gathering outside the Grand Hotel. We shall break at a convenient point for 10 minutes during the meeting. Can officers introduce themselves, please, with their job titles when they first address the committee for the benefit of those watching the live stream? I have apologies from Councillor Baker, Councillor Hollier, Councillor Fitzpatrick, Councillor Heaton, with Councillor Anna Perrott substituting for Councillor Fitzpatrick. A warm welcome this evening to Councillor Perrott, who's running a few minutes late. Do we have any declarations of interest, please? Looking at item 1. Councillor Webb.
Thank you, Chair. I'm, if I'm honest, just scrabbling for where the reference to it is, but there is a reference in item 4, I think, to Pathfinder Multi-Academy Trust. I've declared this interest previously that I am a teacher at a school within that trust, but as it's mentioned specifically within the papers, I thought I'd best raise it here.
Thank you very much. Anyone else? I'm going to declare an interest and take declare for transparency, really, since it's on the council's register of interests. But I'm also a director of City of York Training, work with York, work with schools, etc., who recruit many staff for CYC, including social workers and education staff. Now turning to minutes, item 2, minutes of our meeting held on 21st of July. Does anyone have any revisions or points they wish to make, please? Gosh. Any thoughts, Councillor?
No, I would agree.
Okay, so I will agree on 2 and sign at the end of the meeting. Item 3, public participation. We have no registered speakers tonight. So I now move to item 4, safety valve agreement. Maxine, thank you.
Working. It's not turning green, which is what was confusing me. That's it. Thank you. Thank you, Chair. Maxine Squire, Assistant Director, Education and Skills. The purpose of this report to Scrutiny is to provide you with an update on the progress made on the delivery of the safety valve recovery agreement, which is an agreement between the Department for Education and the Council around the management of a deficit, a historic deficit within the high needs block of the Dedicated Schools grant. The terms of the grant are that we would work together to bring the high needs block of the DSG back into an in-year balance position between 2022 and 2025. What I would stress is that we are one of a number of local authorities that have entered into safety valve agreements with the Department for Education. There are a number of different financial recovery programmes which are being run by the Department for Education at the moment, and over 50 local authorities nationally are in a position where they are required to look at some corrective action in terms of the high needs block of the Dedicated Schools grant. It does reflect the pressures within the SEND funding that all local authorities receive, and that's largely because the original financial agreements, which were linked to the implementation of the Children and Families Act, were put in place in 2014. And no detailed work was done to project the impact of that over time. One key action, obviously, was the introduction of the Education, Health and Care Plan post 2014, which a major change from the old support for children with significant special educational needs was the statements of special educational needs. That ended at the end of statutory school age. As part of the 2014 reforms, the support extended that age range from 18 to 25. And that was key, really, to the modelling of the full impacts of those reforms. So what a number of local authorities, in fact, the majority of local authorities have found is that extension to 25 is creating increasing pressure, because obviously the numbers of plans that are maintained has incrementally grown over that period of time between 2014 and 2022. What I would say is that we, in entering into the agreement, we thought very carefully about our overall improvement plan linked to our Ofsted inspection in 2019 and the areas for improvement that were outlined as a result of our written statements of action. So in our negotiations with the Department of Education, we were very clear that what we wanted to do was to ensure that our plans took forward the areas that we'd already identified as part of that written statement of action, that we were not just starting on a new set of actions which were linked to the safety valve agreements. And it was about putting in place improvements in our local area, both in terms of processes and the way that partners work together, which would overall result in improvements for the experience of the way that SEND is delivered in York and the way that the reforms are delivered in York. And so the priorities that we've identified are the priorities that we had identified as part of our improvement journey. And it's really, really important to stress that when we began the safety valve agreements. These are very much priorities that we felt were important to send reform in York. So what we were started with was not with the idea of just managing a financial deficit. We were also very much thinking about how did we ensure that the priorities that we identified put children and families at the centre of what was important in terms of the reforms that we wanted to make. And key to that was ensuring that we're working together to deliver independence, appropriate independence for children and young people as they travel through their journey, and that they feel fully included within the City of York through the actions that we take. We also, as well, when we were putting together the safety valve actions, thought very carefully about some of the other pending reforms in the system, including the government's green paper, and ensured that there was a read-through between the priorities within the green paper and the priorities that we had focused on as part of the safety valve agreements. So what we have identified is priorities around demand management, the sufficiency of appropriate provision within the City of York, inclusion in mainstream, which is a key part of the green paper, and also improving the preparation for adulthood so that we are focusing on independent skills and also being ambitious about pathways into employment for young people who have special educational needs and disabilities, and in particular joining that up with the work that we're doing around skills in the city, and really thinking about those inclusive pathways that supported internships, supported employment, apprenticeships, and ensuring that young people with SEND are fully included within apprenticeship programmes. So we're very ambitious in what we're wanting to deliver through our safety valve agreements. And these are things that are part of, as I've said, a SEND improvement journey, which we've now been on since 2019. The report provides you with the progress that we've made in Q1 and Q2 of the agreements, and we are on track in the current financial year to deliver on the progress that we've outlined in safety valve. So we are reporting that the actions that we are taking are keeping us on track, both currently and over the lifetime of the safety valve plan, to ensure that we are able to bring the DSG back into balance, and that we will, as a result of that, have our historic deficit written off by the Department for Education. That's extremely important to the council as a whole, because obviously it would be a pressure in the council's budget if we don't do this. So it's really important that we're able to deliver on this agreement. Thank you, Chair.
Thank you very much for Maxine. Sorry. I just have one first question for you. I'm sure the others will also have questions. What work is being done to support children actually in schools, in mainstream education, to reduce the need for education, health and care plans?
Thanks for that question, Chair. And it is a crucial part of the work that's taking place at the moment. We have referenced some of the work that colleagues in mainstream are doing to support training programmes for teachers in mainstream. So Pathfinder Multi-Academy Trust, through their Teaching School Hub, are delivering two important programmes at the moment, one being adaptive teaching and the other one, the SEND Champion programme. The SEND Champion programme is very innovative. It is a training programme to ensure that there is a senior leader trained in each of our schools who is not the SEN coordinator, who has then a whole school responsibility for developing SEN at whole school level. It will take time to ensure that these programmes are embedded. But what we are also looking at is how we can begin to think about children who are supported at SEN support, to ensure that we are appropriately putting support into schools, which ensures that they are able to best meet those needs at SEN support, rather than always bringing forward requests for statutory assessment. We've also partnered with the Autism Education Trust to develop training programmes and share resources around how to best meet the needs of autistic children and young people. So there's quite a lot of work going on at the moment to develop that support for mainstream.
It's great, Maxine. Thank you very much. Any other committee members? Councillor Webb.
Thank you, Maxine. And firstly, thanks for all your work on this. I know it's a really big beast to manage. It's a tough one to get right. And I want to start by saying that isn't it awful that we've got a government that doesn't invest in local authorities, doesn't invest in SEND, and therefore can then a few years down the line turn around to us and say, right, you've got no money anymore. We're going to essentially hold you over a barrel and make you do some of these things like reducing access to EHCPs and things like that, in order to give you some money to balance your budget. I think it's a bit worrying really when you look at the options at the end, where option one, which is do nothing, which I don't agree with, but it says would result in an accelerating unsustainable deficit on high needs block. That's obviously correct, but there's no mention in there about the changes to the effects on children. And I suppose my first question would be, in paragraph 6 on page 12, you've got the actions that have been identified. The first one is demand management. And I wonder if you could expand on what demand management is, because it sounds a bit ominous.
Okay. What I would say, it's not as ominous as it sounds, Councillor Webb. And what we as a city are not doing is saying you can't have an education, health and care plan. So that's really important to say. What we are trying to do is ensure that we are working appropriately with families, schools and settings to think about what support is going to make the greatest amount of difference, because sometimes people do feel that even when they've got an education, health and care plan, things haven't significantly changed. So what we're looking at is, as a system, what can we do together to ensure that children and families get the right support at the right time that's going to make the right difference for them. And so it is sometimes appropriate that they could get that support without an education, health and care plan. So not just viewing it as the only route is through that doorway, but also starting to look at how can we get the right support to the right people in the right way without them necessarily having to go down that route of a very formal assessment, which doesn't always, as I say, improve things significantly. So we are beginning to look at that. We're also looking at as well, when is it appropriate to actually end a plan for a young person, and making sure that we have a much better transition to adulthood. And that's an area that we're working very actively on with our specialist learning and employment advisors. It's being owned right across the work that we do with partners, with our colleagues who deliver post-16 and post-19 education, so that what we are doing now is we're devising a framework post-16 and post-19 where it's really, really clear what the outcomes are for children and young people with SEND, because the SEND Code of Practice does acknowledge the fact that some young people with special educational needs and disabilities will need slightly longer to complete their education and training. And what we need to be better articulating is what outcomes you will get from a particular course of study or training and what happens when that comes to an end. And that's one of the things that we're working on very actively at the moment under that heading of demand management.
If I may, Chair, can I just follow up on that last point there? If we've got a system where we're encouraging more children into sort of mainstream education, which obviously has very fixed endpoints, and you've just said there, Maxine, that actually we need to accept that children with SEND often don't, finish at the same point, so to speak, or can't, and there are plenty of children without SEND who also struggle with the fixed, you're 16, that's it, you're doing your GCSEs, for example. How are we managing that situation? How are York Schools and Academies Board, how is the council supporting schools to help with that situation?
Yeah, obviously the variety, the spectrum of need varies a huge amount. So you will know as somebody who works in schools that you will see a huge spectrum even with those children who've got education, health and care plans. So what we are looking at is what are the most appropriate routes and pathways, and have we got the right mix of provision across the city that means that it's very clear what the outcomes from each educational opportunity is. So we use a number of different providers post-16 and post-19 at the moment. There's a mix of what we'd call more sort of formal providers like York College, like our school sixth forms, and also those that are commissioned to deliver things through social enterprises like Blueberry Academy, or are more work-based in the learning that they provide, like United Response. So it's really working with our specialist learning and careers and employment advisors to look at those young people and what is an appropriate route and pathway for them, and giving them that specialist advice.
Yeah, councillor.
I agree with a lot of what Councillor Webb introduced in the introductory comments. I worry actually for the future with the potential cuts that are going to happen across government, that our educational funding will get even worse than it already is. And one of the negligent things of government has been the SEND review green paper, which we've been waiting for years for. Do we know if we're going to get a white paper on legislation?
There are no plans at the moment to turn the green paper into a white paper. Although work is taking place on aspects of the green paper which can actually be implemented without legislation, and there are some that can actually be implemented without legislation. But yeah, as I say, that's sort of in the gift of central governments.
Okay. And a slightly different thing, Chair. On top of page 16, it says we've had a successful bid for 3 million.
We have.
SEN capital. Does that come off the money that's?
No, that's in addition.
That's in addition.
Yeah, that's an additional capital grants that we've got.
At the end on 22, it says whether York has awarded additional capital funding, which but it is definitely.
But we have
additional.
Definitely got it. Yes, yeah, we have definitely got it.
That's encouraging. It's also encouraging.
It is
what you've written in the report.
Yeah,
Maxine. Thank you, Chair.
Thank you, councillor. Anyone else? Councillor Webb.
Sorry, Maxine.
No, it's all right.
There's just nobody else here. So on page 15, where you've got the table of the priorities, it says create more enhanced resource provision in mainstream schools to support the transition of children with primary need of autism, so associated social, emotional, mental health needs. What I would say that is what form of enhanced provision is that taking, and what funding is there available to create that provision? Because it's almost, if you do it right and you invest properly now, you can save money in the long term. But yeah, but what would it look like, and how is it being funded?
Yeah, so obviously we've got some experience in the city of enhanced resource provision, which already exists. We've got primary enhanced resource provisions, one of which does address the primary need of communication in interaction, which which covers children both with autism and social and emotional mental health needs, and that operates out of Haxby Road Primary Academy at the moment. Our plans are to bring forward a plan to the council's executive around some capital projects, one of which would be to develop another site for Haxby Road on the site of another primary school. We've also got some successful secondary enhanced resource provisions with which also are targeted at the primary need of autism, one being the Wiltshire suite at Joseph Rowntree School, and the other one being the Fulford enhanced resource provision. They've been in operation for a number of years now. Both of those have 10 places for young people with autism, and we're proposing that we create another 10-placed ERP in another secondary school. So those plans are being brought forward to the council's executive to consider. We know that they're successful models. We know from the work that we've done with parents, that Parent Voice told us that they would like to see more enhanced resource provisions because they feel that it's an important part of the way in which young people can feel appropriately included in mainstream, but also have some specialist support.
That's all.
Yeah. The money that government are giving is connected with the children that we have now. is there any contingency if we should get children from other authorities that have high needs and therefore high costs?
Obviously,
will the government look again at that situation?
yeah, obviously, part of the process of quarterly monitoring with the DfE is to look at what's changing as we're working through the lifetime of the agreements. We will be very honest about changes in the local area with them, and also any potential problems that may cause for us. Because we need to be proactive in terms of our engagement and the way that we manage this. Because as I say, we are really ambitious for the children and young people of York, that we don't view this as being a deficit model. We really don't. We want to ensure that what we are doing is right for children and families in York, given that all of us are working in a climate where that there will never be an open door in terms of resource, but we want to ensure that we're taking the actions that will make the greatest amount of difference.
Great, thanks, Maxine. Any other questions? Councillor Webb.
Just one last one. On the page 16 on the consultation section, so it says, in developing and delivering the safety valve agreement, consultation is taking place with schools forum, parents, carers, children and young people. And then Q3 will focus on the implementation of a communication plan. Who is that communication plan going to be with? Because obviously we're talking about, sort of following on from what Councillor Orrell has said, we've got children and families who haven't entered the system yet, who then enter the education system, and maybe what they were expecting wasn't going to be there.
Yeah.
And that is going to be really challenging and really upsetting for some families. So how have we got an open dialogue with families, and how are we constantly checking? I'm really worried about us, missing young people or children getting into a position, because we're talking about often vulnerable people who don't have the ability to speak for themselves. How do we have that constant check that we're not doing a disservice? And I take your point, Maxine, about we don't live in a world of any money for anybody apart from bankers, but what can we do?
Yeah, the reason why we're focusing on communication in Q3 is precisely that, so that we are thinking about ways in which we can reach people proactively who perhaps don't engage with the parent carer forum, perhaps don't use some of the normal communication channels that things are put out by. So we've been developing quite a comprehensive communication plan to look at how we can do that. Many parents tell us that the way that they find most accessible is when communication goes out from their schools. So partnering with our schools around how to get key messages out in front of parents is one of the things that we will want to do. We now, because we are in the situation where we can do more face-to-face events, because we were constrained a little bit earlier by not being able to do that, we are going to put on a lot more opportunities for face-to-face events for people to come to and to find out more.
Thank you, Maxine. I think that's all the questions. And thank you very much for your time and for your report. Thank you. Right, now to item 5, sorry. The 2023 Finance First Quarter Monitoring Report from Richard. Hi, Richard. Can I just ask, first of all, if you can find my page. Bear with me. The first column says 2022-23 outturn. Should that be 21-22? Yes. Right, that's fine. That helps my understanding. Thank you very much. Floor's yours.
Yeah, thank you, Chair. I'm Richard Hartle. I'm the lead for finance within children education. So this is your first quarter report for 22-23. As usual, this is an extract of the overall council quarter one report that was presented to the executive in August. The year-end projections are summarised in table 1, and what they show is a projected overspend for the year of about £7.3 million. And that does compare, as you've rightly pointed out, to the outturn position at the end of 21-22, which was about a £6.5 million overspend, an actual overspend in 21-22. The three main areas that are contributing to the overspend, and they are firstly placement costs within children's social care, which contribute about 4.6 million to that overspend. Also significant pressures that we have projected on the year around children's social care agency staffing that are contributing to that overspend. And then also on a slightly smaller scale, but still significant, we're projecting about a £600,000 overspend on home to school transport. So those are the three main areas that are contributing to the overspend. The report does also mention a little bit around the DSG. Clearly, you've been into that in a bit of detail with Maxine, but effectively reports that we are on track in terms of delivering against the safety valve plan. So although we are currently spending more within the DSG than we're receiving from the government, that is in line with that plan. And that if we keep to that, we should bring that back into balance within the next 2.5 years. So I'll stop there. Happy to clearly take questions and comments from members, deal with as many of those as I possibly can. I'm sure, as usual, you probably stray into some areas in the service, so it's reassuring to see other colleagues from the directorate here as well to possibly help out on some of those.
We understand that, Richard. Thank you very much for that. My question might be exactly that, really. I noticed with interest the huge reduction in the cost of a placement at Wenlock Terrace, from 40k per week down to 21k per week. I just wonder what steps and measures have been taken to achieve that marked cost marked reduction in cost. Can I help on that one?
I mean, my understanding was that was quite detailed discussions with the provider there, and particular work within the directorate. So I think, Martin looks as if he's about to jump in as well and add to that. Thank you, Martin.
Thank you. So Martin Kelly, Corporate Director of Children's Services and Education. So that was about a change in the needs of the in-person, a better bringing a better staff group together and having more confidence, and some very detailed and challenging discussions with the provider of services, which was an external organisation. That young person has actually now moved on to another provision, and that arrangement is also a reduction in cost. We're doing a lot of work across all young people that are in very high cost placements to ensure that we can provide them the best provision, but at good value.
Thank you, Martin. Any questions from any other colleagues? Councillor Webb?
Yeah, could I first just follow up on that point, because I'd noted that one as a particularly, it's good to see us actually saving some money, but what were we not doing before that meant that it would cost us? I know that the needs of the child changed, but in a more general point, what have we been missing before that's meant that some placements are costing us a lot more? And you've just mentioned the fact that you're looking at lots of placements to see if you can save money. So what are we doing different now to the past?
Okay, so nationally, there's a relatively arguably broken care market, which is mentioned by Josh McAllister in his National Care Review. So we're in a position where often demand is higher than supply. So finding a placement in the first place is very hard. And for that particular child, we had to set up an emergency placement, having had a look right across the country with no available placement to offer. And that's the position where we need to put something together very quickly. That is always going to cost a lot more than having something that's always going to be there and available and consistent. We've got a number of plans in place that will ensure that we bring some resource back into the local authority so that we've got available placements when Loch Terrace, for example, a children's home that has previously been within the hands of external providers, looking at how we use that perhaps differently, ensuring that we increase the number of foster carers and the resilience of foster carers through training to make sure that we can place children in family arrangements where possible, but also having some very challenging discussions with some of our providers around making sure that what they say they're doing, they are, and where they're asking for additional staffing to make sure that we provide some considerable challenge about why they're asking for the staffing. And an example would be, often we get requests for 2-to-1 staffing for children, but it's really digging down about, what is that going to bring to the placement? Is it because the child's making regular allegations and therefore they need additional staff? Is it because the behaviours of the child are more complex and challenging? But having some rigorous conversations with providers to say that we think you can do that on through a reduced staffing cohort, and what we're commissioning is an outcomes-based placement rather than just a placement. So actually we expect over time to see that you're making improvements for the child and therefore need less staff to look after them.
Thank you, Martin. Councillor Orrell.
Yeah. Richard, the theme throughout the report is that, again, sorry, apologies. The theme throughout the report is the use of temporary staff and how much extra that's costing us. We were trying, I know a while ago, we were trying to get an agreement across councils that staff weren't poached, if you like, from one council to another. Has that agreement come into force?
Yeah, there is a regional agreement now that is in place. It's in its early days, I think, isn't it now? But yeah, that is in place. So, there's hope that will start to make an impact on it. The other thing I would say about this, clearly this is the Q1 monitor.
Yeah.
It went to the executive in August. We're now in November. This meeting has been delayed a little bit. We're working through the Q2 figures now, and there is an improvement in agency staffing. So the projection that you will see on agency staffing at Q2 will show an improvement on the position here. There has been significant work within the directorate, particularly the new management team that came in over the summer. There's been a lot of work in terms of reducing that number of agency staffing and the reliance on it, and the number of posts moved from agency to permanent staffing. So that's something that I'm not able to report on it formally at this meeting, but it will be there at the Q2 position.
Yeah, that's helpful. It's encouraging, Richard.
Yeah.
Thank you.
Yeah, definitely.
Thanks, Richard. Any other questions from Councillor Webb?
Yeah, thank you. And thank you for presenting this, Richard. And I always feel a bit bad because, a lot of the questions tend to be more directorate based. In the annex where we've got the residential provision, the average weekly costs is what I'm sort of looking at. And you've got the 0 to 15-year-olds at sort of 4,419. The additional health disability needs at 5,410. And then the most expensive one is the 16 plus. And I was just wondering, that seems a little unusual, but is there a rationale behind why on average those costs are slightly higher?
I mean, the first thing I'd say about those figures is you'll know that the numbers in each of those categories are very, very low. So, clearly those averages are, it's a bit dangerous looking at those averages because it will depend on the circumstances of individual cases within there. And the needs of those individual children. So, just with those small numbers, it can distort those averages quite a lot. So in one respect, I wouldn't place too much credence on those in terms of the comparisons because of the low numbers in there. Probably not much more than I can say to that. It will just be the individual needs of those children, won't it? And an odd one there that's more expensive will distort that figure significantly, even if the rest of them are lower.
I think it may also include the placement that we were talking about in terms of that very high cost, £40,000.
Which, that's exactly what, underlines that position. So.
Thank you, Richard. Any further questions for Richard? Okay, thank you, Richard, once again, and we'll see you again in December for Q2, I think. Thank you very much. Before we move on to item 6, I've got an announcement to make really from CSMC. At their October meeting, they expressed concern around 2 areas that fall under our remit, and have made a formal request we monitor the business case on each. One is projected overspends on looked after children on out of area placements, and the second is an overdependence on agency social workers. I intend to address this issue by restoring the performance data reports that used to come to us before January 2020, and which have instead been covered by the director up until now, presenting financials verbally with reference to the business case. I discussed what data we need with the corporate director, but the data already goes to executive and executive member. In my understanding, it can once again be brought back to us too, without adding to staff workloads and assembling data. Any questions on that? Right. Basically, we used to get the data on performance, and we haven't done so since COVID. So we'll be hopefully returning to that former position. Item 6, Ofsted Action Plan. Daniel Johnson. And Martin Kelly. Thanks, Danielle.
Hi, Danielle Johnson, Director of Safeguarding and Children's Services. So the purpose of this paper is to update on the progress against the post-Ofsted plan. We were inspected by Ofsted back in March 2022, and we got an overall judgment that we requires improvement to be good. At that point, we developed a plan, which was considered by this committee and endorsed by the Council Executive in July 2022. So there were 7 areas, and I've set out the progress against each of those areas. So firstly, it was around the consistency of written records, so that they provide an accurate account of decision-making for all children. Practice standards have been updated. Young people have developed top tips for practitioners, action learning sets and training have taken place to drive practice, and a library of good practice examples for practitioners have been developed, so something that they can refer to. The quality of assessments to ensure that they consistently inform the care planning for children and young people. Work has been undertaken with managers right across the service to really look at what a good assessment for children, young people and their families looks like. That includes the expectations we have of managers around management oversight. Systemic practice has been rolled out across the service, and our care plan for children and young people who are in care has been strengthened, and we're just about to roll that out across the service, that every young person over the age of 7 will have one of those by the end of December. We've looked at the effectiveness of social work supervision, because that was raised, particularly around progressing plans for children and young people. So practice standards have been developed for our staff. The supervision template has been revised, and heads of service are really dip sampling and looking at the quality of supervision, and we will further do a thematic audit on that to look at the impact of that. The analysis of return home interviews there for children and young people who are missing from home and care. So the protocol has been revised with the police, and the multi-agency partnership have approved that. And multi-agency reviews of repeat missing from home episodes, so those children and young people who are repeated missing from home, they come together and they review them and look at themes within them. We've undertaken an end-to-end review of the missing from home and care process that is complete, and we've got actions from that, particularly around our supervision and how we and the actions we formed from that analysis. Responses to children and young people who 16-17-year-olds who present as homeless. So advocacy has now been extended to all of our young people. and the homelessness protocol has been updated, which provides a clear pathway. Information for children and young people has also been updated, which young people have helped us in reviewing that. The pace of planning for unregistered children's homes. There is weekly oversight of the young people in unregistered children's homes, and a review is underway to look at what we can learn from previous issues that we've had around that, to prevent us using that going forward. And the placement finding capacity has been increased. So we've got more people there helping us identify placements, making sure that the right placements are identified for our children and young people. Children's influence, and particularly attendance at corporate parenting board and the Speak Up service and corporate parenting advisors have developed briefings, which is really positive, and corporate parenting advisors are now full members of the board, which is good. So that provides an overview. I'm not sure if there's any questions.
Thanks, Danielle. I just wanted to ask, quite interesting, can you give us some idea of the tips that young people have provided for practitioners in improving the consistency of written records of decision-making for children?
Young people, those tips are very much about not using jargon in those records, that they're easily understandable to them. Our children in care service have really adapted that, where they're now recording their records as if they're talking to the child and young person, so that if they ever come back and have a look and read them, they're really clear to them. But it very much has been about, think about us in our shoes, really, and how you would want things to be reflective, non-judgmental, understandable, particularly using people's full names and titles so that they know where they're from if they ever look back at them and things don't get lost, that decisions are clear and the rationale for decision making as to why that decision was made and what was taken into consideration.
Yeah, that's very clear and helpful. Any other members of the committee want to ask Danielle a question? As a web.
Hi, thank you, Danielle. It's always good to get an update on the Ofsted progress against the action plan. On part C, the effectiveness of social work supervision, it says at the end the heads of service are regularly sampling the quality of supervision. Are we seeing an improvement, and how do we evidence and sort of quantify that? You know, how do we triangulate whether there is an improvement or whether people are just ticking the right boxes? You know?
Yeah, so they are regularly dip sampling that and looking at the quality of supervision. Part of that also includes speaking to practitioners and getting feedback about the quality of supervision that they get. It's all we look at that as well as part of our audit work, which we now call learning conversations. So we sit with a practitioner, we have a conversation about it. We will ask them about the quality of their supervision that they are getting. It's about the impact upon children and young people and children and young people's plans, making sure it's outcome focused, that we can see the child's voice, the views of the family, that risk is managed, that actions are progressed. We will, as we move into next year, do a further thematic to deep dive into that and look at how we continue to drive that forward. But we know that with good supervision and support, we'll keep practitioners and we'll get better outcomes for our children and young people.
Thank you very much. That's a web again.
Yeah, thank you. On point, firstly on point E, I think just to say it's really welcome that advocacy has been extended to all young people presenting as homeless. I think it's crazy to think that wasn't in place in the first place, but I think that's a really positive step. Point F, pace of planning for children in unregistered children's homes. So I've got two questions here. The first one is, you know, we have one young person in this situation. How long, probably a better question is not how long has that individual being in the placement, but on average, how long are children in these unregistered placements? And then the other question is, it's great that we've built capacity, or we've found capacity within the team to look for more placements, but actually, are there any out there?
I think in response to your, it's very difficult to say how long a child or a young person will be in that sort of arrangement. It's about identifying an appropriate and suitable provision, and that's difficult to say how long that can take. I think that around additional capacity, you're right, and I think Martin mentioned earlier, it's very difficult. And nationally, it's a problem around the range of placements that are out there. The cost of the placements is a concern for us. But I think it's about ensuring that we're having that appropriate challenge, that we're really, even at the highest level, understanding the needs of the child and family, looking at all the available options that are right, and thinking about longer term outcomes for children as well, that this isn't just something that we're going to do here and now. We need to think about long term for children and how we can meet those needs. So when we are looking at those sorts of placements, we need to be really thinking about how long is that going to be for, and when we are using external placements, what is the exit plan for them? They're not going to stay there forever. They're not going to stay post 18. So how do we manage that? Ensuring that every decision we make about it is really scrutinised and it's the right decision.
Thank you. Any further questions? Awesome.
If I can just add to that, particularly around the sufficiency of placement. So the local authority has a legal sufficiency duty to find placements for children, to plan for placements in the long term rather than just the short term. The only way of combating that market and the problematic market that we've got nationally, so 82% of children that are in children's homes are delivered within the private sector market, and with most authorities are starting to bring that back and see that actually the only way to have some control is to build that internally. So part of the answer is to build our internal capacity both through foster care and some residential care.
Thank you for that. Any other questions? Hello.
Thanks, Chair. Can I ask around point B with the care planning, how young people are being involved in that sort of strengthening process, as it says that once it's been rolled out, it'll be rolled out, once it's been considered further by young people. So could you just sort of talk us through how they're involved in that process, please?
Yeah, so young people have been involved in the document itself and putting the document together, thinking about what are the important things that they would like to be in there, what they would like to know about, the style of that document. So that has been considered by our young people, and that's how they've been involved.
Can I just follow up with that? Are they involved sort of after care plans are in place, sort of how active is their involvement? Sort of are there opportunities for them to sort of continue feeding in after that process as well, rather than just the initial design phase? Yeah, in terms of my previous comments, they were around the document itself and forming what that should look like for all of our young people. They will continue to have reviews of that they will be absolutely actively involved in their care plan. We're doing an awful lot at the minute to really reach out to our young people to understand from the highest level around their views and wishes and feelings, particularly when we've talked about external placements, and part of our reviewing of that has been really thinking about advocacy, particularly for our young people who are placed outside of the city. We want to understand their views about that, where they would like to be, thinking about how they can come back to the city and how we can support them with it. But they're absolutely involved in that on an ongoing basis.
Thank you, Danielle. Any other questions from members? In that case, thank you very much, and thank you for the report. Thank you. Right, that brings us to item 7, the City of York Safeguarding Children Partnership from Martin.
Thank you, Chair. So this is an update on the safeguarding arrangements. So I'm going to take you through some of the legal safeguarding arrangements and how they've changed over the years, but then also talk about the independent scrutineer who produces an annual report on the partnership arrangements and explores whether they are secure, safe and appropriate in terms of what we're doing as a partnership. So initially, in March 2016, the government accepted recommendations of the Wood Review, which summarised the findings of the National Review into Local Safeguarding Children Boards. The recommendation of the report led to a change in legislation, removing the statutory requirement for having local the requirement of local authorities to have a local safeguarding children's board, and they were replaced with local multi-agency safeguarding partnership arrangements. The City of York safeguarding children's partnership arrangements is a statutory body that replaced the LSCBs and work with all agencies to safeguard and promote the welfare of children and young people in the city. And now on slide 3 with the pictures on, just so you're aware where I'm going. So within the last 2 years, there have been a number of organisational changes across a number of partner agencies. However, despite some of those movements, certainly at senior level, our scrutineer found that the statutory partners have remained focused on ensuring that children and young people across the City of York are safeguarded. That was her finding. I've joined as the new permanent director of Children's Services in August, bringing further stability to York with an intention to stay for some time. Danielle Johnson, who you've just met, is the new director of safeguarding, and also brings a wealth of safeguarding experience, partnership experience from another local authority, and will also secure a great deal of she understands the partners that we're working with. She's worked with them for a long time, having worked with a local authority across the border. I'm really pleased to report as of December there will be a permanent leadership team across Children's Services, which will again give us considerable experience and a sense of permanence that will certainly contribute towards better partnership working and improved partnership working. North Yorkshire Police have appointed a new Assistant Chief Constable, who is Mike Walker, currently in an interim arrangement, but they've also recruited a new permanent head of safeguarding. And following the police inspection, it was recognised that more resource was needed within the safeguarding team, and they've created additional detective chief inspector role in addition to the already established post. And that brings an additional capacity in the police and shows their continued commitment and recognition for the work around safeguarding children. Recruitment continues to establish the new integrated care system and the move away from the clinical commissioning groups. And during that transition, Michelle Carrington is the statutory partner from Health, who continues to be a very stable senior leader within the 3 statutory partners. So the role of the independent scrutineer, and the independent scrutineer for York is Dr. Maggie Atkinson. Maggie Atkinson has held a number of national roles, including the National Children's Commissioner. So it comes with some gravitas in terms of what she says about how things are working in York. The role of the independent scrutineer is absolutely to ensure that they look across all the partnership work and satisfy themselves that we're working effectively to safeguard children. Maggie is unfortunately leaving us in December. She's given notice. And we're committed as a partner, a set of partners, to rapidly recruit into that role, and we're confident that we will recruit into the role, if not in December, certainly in the very early new year. I've met with partners and we've agreed the parameters for recruitment, and we're now progressing with that. And would like to take the opportunity to thank Maggie for the work that she's done in the last couple of years for York. We're planning a partnership day to align with the appointment of the new post, which will bring together the 3 statutory partners, key stakeholders, and all relevant agencies. And that will be to bring together and outline our priority areas for the future, particularly paying attention to the obvious issues that we're dealing with that have an impact on children's safeguarding and impact on children's lives, including the pandemic, but not solely the pandemic, and certainly will involve the issues around cost of living and the crisis that we're in nationally, as well as issues around mental health, which we know is a troubling issue across all age groups. So I'm now on slide 5 of the 7. So the areas that areas of key activity that we've been looking at across the partnership are a variety of inspections that look at safeguarding children. There's the inspection that we just heard about in terms of the local authority, the inspection of child protection within the police, and we've had a youth justice inspection in September 2022. All of those, whether good or whether they require improvements, they all will have some recommendations, even where there's a service to be found outstanding. So as a partnership, we need to make sure that we concentrate on some of the areas that are identified. And again, when we have a partnership day, those are the areas that we will focus on, the things that have been picked up inspection. And to assure ourselves that not only we're working individually on those issues, but we're working in partnership, which is increasingly incredibly important, particularly as resources across public services are stretched, to say the least. I think Maggie Atkinson found that despite all of the changes across the services, that we have very, very strong arrangements in place. And there's things to build on. She's given some ideas within the report. The report is a public document. It will be on our children's safeguarding website, but has had some issues in terms of presentation. So we're just trying to get the presentation issues right. It will be published by the end of this year, so certainly before the end of December. So I think Maggie's also confident that the partner of the representation across the executive, but also all the subgroups, and there's a number of subgroups that meet around training and lots of other issues, confident that those subgroups are working together, working in partnership, and come with considerable commitment from all agencies. Voice of children is an issue across all agencies, but it's something that all of the conversations we have across partnerships is really concentrating on to make sure that we can get that right. We've heard about some of the progress of the local authority with Danielle's reporting. There's more work to do, and we're looking at a range of opportunities to engage young people in almost in a live discussion. So if young people are concerned about what's happening on their day-to-day care planning, there are a number of apps available that we can use potentially that will give us some live information that will go straight into our system. And again, the partnership will look at whether that's something that we can work together on, or something that will be just against the local authority. Areas of challenge highlighted by the scrutineer for partnership to embed improvements to be made throughout all inspections, as I've described. Observations by the scrutineer throughout 2021-22, whether there's been ongoing, often very complex, professionally wearing challenges, and those are the words of the scrutineer. Meeting the demands placed on all agencies by the pandemic, and the challenges, as we know, went on for far longer than ever originally envisaged, and I think that's had some significant impact on workforce. The workforce across public services, we're seeing a fairly significant change, both as a result of people making different decisions about their career choices. People who are perhaps not wanting to work in the same way as they have done previously, but also people choosing to take private sector jobs above public sector jobs, and that's affecting all the public sector, whether it's health, local authority, or policing. All are struggling to get the right workforce in place. Issues of resourcing remain considerable across all partnerships, including the reducing resources that we're working with through austerity, but ongoing issues around the availability of money in health, policing, and a local authority. And as many know, we often have difficulties in terms of money going into acute services without sufficient money going into early help. That's not just within a local authority context. That's in health services, acute health services, and policing resources. We've talked about the availability of cost and the cost of provision for children and young people. That was something that Scrutiny highlighted in reports as something of concern. It's a concern nationally. It's been picked up in the National Care Review, and we will hopefully hear what the government's response is in December in terms of the National Care Review that may help deal with some of those challenges. And then Maggie felt that it was important to mention as a separate issue the mental health of children. Given the pandemic, we know that's had an impact at all levels of mental health, both early presentation, but also some of the more acute mental health for young people, not just pandemic related, certainly related to other things that are going on in the world as well. And some of those solutions are very hard to secure, both as individual agencies, but actually as a group of partners. As we've talked about, limited resources in other areas, because of resourcing in health services, they tend to be taken by the swollen number of people that are in acute services, and it's very difficult to try and move funding into earlier health service. So beyond the issues that we need to work on as a group of partners will be all of the legislative policy. We've talked about some of it in terms of the SEN Green Paper, the new schools bill, and the National Social Care Review. And as I've said, the government aim to report on their response to that review in December. There will be a revision of Working Together 2018, following the changes in health from CCGs and move to integrated care system. And a range of changes in government policy, particularly around areas for things like cost of living, the cost of living crisis. So we need to ensure that families continue to receive the right support at the right time by all agencies. And actually partnership is probably more important now than it ever has been in terms of using resources sensibly, but also together. We know that families are starting to struggle that previously haven't done, and that's an issue in all parts of the country. But certainly no different for York. All services are continually committed to driving forward improvements at pace across inspections, but also ensure that we can perhaps look at issues together, look at innovation together around some of those knotty issues of the workforce and staffing issues. Can we do things differently? And we need to do some ongoing work in terms of refreshing the Children and Young People's Plan. There is no longer a statutory requirement to have a Children and Young People's Plan, but the partnership are absolutely committed to maintaining one and to ensure that safeguarding is an absolute priority within that. And that certainly sets the context of how we want partners to focus their resources and focus their efforts for the future. So that plan will be developed in the coming months and signed off by a range of, it will need to be signed off by all partners. I think most importantly, whilst there are some concerning issues going forward, I think it's really important to say that partners are absolutely committed, and probably more committed than they ever have been, that coming together and working on some innovative solutions, looking for strengths rather than just perhaps being overwhelmed by the challenges ahead. So that gives a brief overview. As I say, the report I would have hoped to have had at this meeting, but it's perhaps down to design issues and other things that I haven't been able to get on time.
Thank you for that, Martin. It's very welcome. I just wondered if you could give us some detail on the Youth Justice Service inspection. You mentioned that everyone has a need to improve. I just wonder what sort of detail you might be aware of in that particular group?
Okay, so the youth justice inspection is still embargoed until later this month. However, I will say we're exceptionally pleased with the outcome. So very positive. I think having come from a different local authority, I'm exceptionally pleased to come to a youth justice service that does a huge amount of work around prevention. And staggeringly, we've managed to keep the majority, 99% of children effectively out of custody. And whilst that creates its own challenges, the reality is that we know children going into adult life who go into custody are much more likely, all the research shows, are much more likely to reoffend. So keeping children away from the custody system is more likely to keep them out of adult offending as they go into later life. So really pleased with the outcome, and a shame that I can't provide the outcome.
There'll be a time, I'm sure. Thank you very much for that. Any questions? Any questions? Any questions, colleagues? Anna.
Thanks, Chair. I just wanted to ask around the challenges and improvement on the point around services and how early help's not always funded sort of as much as we might like in comparison with acute. Do you think that the integrated care system changes are going to help with that? Are we going to have more of a sort of ability to influence how funding will be balanced between those two? And I understand obviously acute care is something that you can't really compromise on, but yeah, if early help has been neglected, it's how much can we do to tip that balance?
So I think it is. There are certainly opportunities, and actually moving to an integrated care system will move some national NHS resources towards more local place-based resource. I think what's important, given the size of what is described as an ICS place, is that we're at the table making sure that York is well represented in all of those discussions. An example of national resources, that some of the resource that would have effectively been provided for what is the acute end of mental health, so in-house mental health beds for children, hospital beds for children, that would have been resourced through a national resource base with the NHS, which means that they were disconnected in many ways from there was no incentive in many ways for them to put their resource into early help services, because that was a disconnect from local services. I think as that develops, I think there's lots of opportunity for us to have a debate about making sure that we push resource further into early health services, particularly around mental health.
Yeah, any other questions? There's a web.
Thank you, Chair. On the key areas of activity for CYSCP, the voice of the children, you mentioned it briefly about a potential app, which is a solution for lots of things. I think slightly cynically, that tends to be the way it works on it. Can't do much, let's do an app. But is it, in terms of the voice of children, is this an issue across all local authorities? Is there anything specific about what North Yorkshire haven't been doing that's causing issues with the voice of the children? And in terms of an app or whatever the solution might be, you know, how would that app actually help improve the voice of children? You know, would it cover all areas of the children's lives, or would it be specific to children's social care? Or, you know, would it include things about the fact that CAMS isn't doing enough, or what would it include? What would be best?
So I think it does relate to all services. And I think when we talk about the voice of the child, we've often got an understanding of what the child's needs are, and you would hope that we have. However, I don't think that when we talk about the voice, we don't have a good understanding of their lived experience on a day-to-day basis. So how does it feel to be in their shoes and to walk a mile in their shoes? And so I think it's much more comprehensive than perhaps some of the things that we've done in the past around surveys, or, you know, getting a representative group that tells us how it feels to much more of actually we need to have the voice in every child that we work with and every child that we come across. And that includes, I know the police are doing a great deal in terms of when they come across a child on the street, when they're arresting a child, ensuring that they really understand what's going on for them, and you know what's led to that interaction. In terms of the app, it's called Mind of My Own. It's a well-established app that's been around a long time. They, as a company, have developed, they continually develop in a range of areas. They started in social care, and it gives an opportunity for a young person to, for example, through a particular day to say they're struggling with their mental health, that they are struggling in a particular area of their life, that they do or don't like their social worker, a whole range of feedback through a range of very simple questions. And that feeds straight back onto our system that the children's social workers use, and therefore demands of them a response. So there's a sort of ongoing interaction, not something that you'd expect to see lots of messaging, so not like emails, but something that gives us a great deal more depth into the lived experience of children, and ensuring that we not only hear their voice, but actually we listen to them and make sure that we try and do our best to meet their needs. Bearing in mind that we can't meet all of the needs. You know, if a child says, I want £500 pocket money, then we're not going to respond in the way that say, yes, we're going to do that. But if a child says, you know, I'm being bullied at school, then we take that seriously and urgently, and have a discussion with the school rather than wait for the next child's planning meeting or the next review or the next time the social worker visits. It's much more interactive in terms of being able to respond to their needs.
For that, any other questions? Councillor Webb?
Yeah, just to follow up on that. I suppose if individual social workers are getting responses from particular children, you know, how do they then link together and potentially feed up the chain towards you to sort of see that, okay, actually across the area we're looking at, self-harm is a particular issue? You know, how do we all link it all back together?
It's a really good question, actually. I think this app has the facility to be able to mine data, and effectively so it can go from individual to very strategic and look at is there a range of particular themes that we need to start to dig deeper into, and that would, you know, if we wanted to dig it much further in terms of you know, is there a particular community, is there a particular school where some young people are all saying something very similar, so we can deal with a particular community issue or a school issue. So it's a very clever app in terms of being able to mine data that helps us inform policy developments and practice developments, as well as making sure that we respond to individual need.
Thank you. Any other questions? Thank you, Martin. Thank you for your input this evening. I think we can let you go because the next item is the work plan, which is something we have to go through each meeting. Thank you again. Right, everyone. Item 8. I'm going to begin by suggesting a change to the order when we see reports. The new chief executive of the York Museums Trust doesn't start full time until the 1st of January, though she's been doing some part-time work with the trust already. That means, of course, she's hardly going to have her feet on the table to discuss vision, progress and performance before Christmas. So I'm going to suggest that we move that particular report to March and then move the report from the York Citizens Theatre Trust into December the 20th. We all happy with that suggestion? I shall leave that with Jane then to make the arrangements. Thank you for that. Martin Kelly suggested that we consider a report on the child death overview panel. Now, I've spoken to Joanna Hussain, who's explained to me that the reports should go to Health and Wellbeing Board. But there may still be a role for CEC, and this needs some further consideration. So we'll make some further inquiries about what Martin actually wanted us to consider aspect, and then we'll pick that up and action it. Councillor Webb and I are attending the HASC scrutiny on 14th December in order to feedback to this scrutiny on the developments of the ICS, particularly in relation to safeguarding and place. There is an opportunity for a CEC commission slot at the end of January to host any outstanding reports, such as a child death overview panel one. Any comments from anyone on any other items?
The only thing I'd ask that the previous item that Martin's introduced obviously referenced an actual report from the independent scrutineer, and as that scrutineer is now finishing, it doesn't have to come to a meeting, but I think it probably would be appropriate if it was sent round to committee members to have a look at, and there might be something out of that we then thought, yeah, we want to take a look at that.
I think that's a very good idea, and we can then take it up with the new scrutineer in time, should to do so. Can you? Thank you very much. Unusually, I've got something to mention under urgent business, which is item 9. Martin Kelly has advised all staff in the council that there will be an Ofsted inspection starting on 14th November for effectiveness in identifying and meeting the needs of children and young people with special educational needs and disabilities. We shall obviously await those outcomes with interest. Any other points that people want to raise? Councillor Webb?
That might be worth the commission slot in January, might it? Just putting that on people's radars.
Indeed, yes, it could come to that commissioned slot we have on the end of January, but as planned. Right, in that case, I don't think there's anything else to cover, so we should close the meeting, and thank you all for your attendance and your input this evening. Thank you.